Hello, and welcome to my three main ethical principles that I have chosen and I choose to follow on a daily basis when it comes just to personal life and to my job. Um, I think ethical principles are something to really keep in mind and to have, especially to have a main three whenever you are working in a professional setting, one-on-one with a patient, one-on-one with a client, whether you're a provider, a therapist, a social worker, work for insurance, work for HR. It's just important to have these ethical principles in mind and to have three that you personally choose to follow and you personally choose to practice on an everyday basis. So to start off is with my personal vision statement here. To me, my personal vision statement is to properly treat patients, respect them, and ensure their wishes are respected, no matter my personal beliefs. The personal beliefs is a big one because there are many different types of beliefs out there. I know, like you see, like maybe in medical shows and stuff like that, where a patient comes in and it turns out that that patient has done something really bad. They come from jail and they've done something really bad, and the providers sometimes are hesitant about treating them properly, giving them treatment at all. And I think that's something that just kind of needs to be pushed to the side. I mean, I do agree with them that like it sucks that we would have to treat this person who's done something so bad, but we are providers and we're there to treat no matter what. So sometimes we have to just push our beliefs to the side and give that treatment no matter who is in front of us, who we are treating, and what they've done, or what even religiously what they believe. My three ethical concepts that I choose to follow is beneficence, non-maleficence, and autonomy. To me, these are the three that just kind of cover every aspect that I believe a provider should do, every aspect that I believe a provider should follow. And I just kind of see them summed up under these three concepts. So to move on to number one here. Beneficence is defined in Webster Dictionary as the quality or state of doing or producing good, the quality or state of being beneficent. So to me, this says just an overall of doing good, providing good treatment, providing good quality of care. And so in my everyday life and my job, I practice this by working with individuals with disabilities to promote lifelong skills and so that they can live independently. So I work for Arc of the Ozarks. I see clients every day that I work who they have some sort of disability. So sometimes these lifelong skills are learning how to budget, learning how to keep a room clean. That's one of them that one of my clients really struggles with, cleaning up after themselves. Just understanding real world skills. And so I work with them to provide good practice, good treatment, good education about how to perform these type of activities, how doing these activity in what way develops good skills for them, helps them learn the best. And so this is just a practice I do every day, because if they aren't learning these skills, then that means I'm not providing quality treatment. I'm not providing quality education where they learn these practices, they learn these skills, they learn to be independent. And so the third one here is non-maleficence, and that is simply defined as to do no harm. And so every provider, when they take an oath to do no harm, it seems like such a simple everyday practice, but yet we see almost not every day, but quite often about like a nurse, a provider, or someone who purposely harmed a patient or a client. And this is often seen in like elderly or, and again, with my example of my job, individuals with disabilities, they're the ones who often get taken advantage of. And so this again is an everyday practice to make sure that harm is not inflicted to my clients, especially by me, because I never want to provide any harm, especially intentional, to anyone I encounter, anyone I treat, anyone I provide services to. I never want to inflict harm on them. And I can also follow this by being a reporter, by making sure I report when I see harm happening and knowing who I should be reporting this to. Okay. And now the third one, here it is autonomy is simply defined as everyone has the right to make their own decisions and moral choices. So again, this is an everyday practice for me with my job. When I work with clients, I make sure my clients make their own choices. That's one of the main goals we work on, is to make their own life choices. And I do that by making sure they know what rights they have. They know what goals they have to meet, and they get to choose what goal they want to work on that day. Whether it be going out to the store and practicing their budgeting, whether it be, you know what, my room is really messy, I need to clean my room. And so making sure they have those choices, they have the choice of what store they want to go shop at today. And so these are just choices they get to make. And I never want to be the one to come in and say, oh no, you can't go to Walmart, we're actually going to go to Price Cutters. Or I can give them choices and say, you know what, let's try Aldi's if you want, because you're trying to learn to save money and budget. And that's a great choice to go and save money, as they have cheaper products and cheaper options. But in the long run, if they choose, no, I don't want to do that, then we go wherever they want to go. It is my job to make sure that they get to choose what they want to do. And I don't get to step in and tell them no. So those were my three main concepts. And now the actions I can practice every day to make sure I maintain these is to make sure I continue to make these practices every day. If I continue to practice these concepts every day, then I remember them. I remember to perform them, and I make sure that I'm performing them, because they're always in the back of my mind. Okay, is my client in harm? Is my client making their own choices? Am I providing a good service to my client so that they can learn these skills, so that they can reach these goals that they have? I can also work on this by always making sure my clients understands their rights. So making sure they understand, hey, you have the right to refuse service. Like, if you don't want to see me today, that's fine. Making sure they know their goals, making sure they know what they're working towards and how they want to live in the future. I can also practice this by ensuring that my clients continue to make their own choices, by stepping in and correcting anyone who might try to make a choice for them. And so I see this often because some of my clients are their own guardians. Some of them have a guardian over them. And if that guardian tries to step in and tell them what to do, how to do things, then it is my job to step in and say, hey, that's a great suggestion, but ultimately, this is their goals they're working towards. This is their life that they're learning how to live on their own. Their goal is to learn how to live independently without having someone at their side 24/7 telling them what to do, telling them how to do things. And so if they continue to step in and tell them what to do and how to do it, then that defeats the whole purpose of why I'm there. So just ensuring these things can help me make sure that I am following my 3 ethical concepts that I choose to practice every day. So that is my 3 main ethical concepts. Thank you so much for listening.